Hi, welcome to our senior project. Today we will be discussing the psychosocial effects of family separation and the fear of deportation on immigrant children. My name is Carla Cupa Baron.
My name is Mariana Paredes Luna,
And my name is Janet Silva-Villanueva.
and we're going to start off by talking about Marie and Yasmin Juarez. They arrived at the US Mexico border in 2018 to seek asylum from Guatemala. They were fleeing violence and economic hardships, but instead they were placed in a detention center in cramped cells where they lacked access to food, water, sanitation, and medical resources. Marie started showing symptoms of an illness, and when she was refused medical help initially, she was only given Tylenol and some antibiotics without actually knowing her condition. After their release, Marie was diagnosed with a viral respiratory infection and she died 6 weeks later. Unfortunately, this case is not singular, and in 2020 alone, there have been 21 people who have died in detention centers. Even though some of these policies have been reversed or removed when the Biden administration came in, it is still important to examine what psychosocial effects we will see from these harsh policies in the years to come. So just to tell you guys a little bit about what we will be talking about, we're gonna start off by defining some terminology that we'll be using along with the immigration policies we will be talking about. We'll move on to the psychosocial effects based on age, and then discuss outcomes, discussion, and some recommendations for future research. So for some terminology, terms such as illegal immigrants and illegal aliens have been used widely in the past to describe undocumented immigrants. However, these terms imply a sense of criminality and inherently view immigrants in a negative light. These terms also aid to justify and normalize anti-immigration policies and sentiments. Therefore, we view these terms as outdated and extremely harmful. So we will not be using them in our research and presentation. Instead, we will be using terms like undocumented immigrants and immigrant families and children. Immigrant families and children will refer to families in which one or more parent does not hold legal status in the US. Children of undocumented immigrants are likely to fear for their parents' safety as well, regardless of their own legal status. Therefore, we will not differentiate between a child's legal status and their parents' legal status. Some of these families are also mixed status families where one parent holds status and their child doesn't. We will refer to all of these as immigrant families and children. Lastly, both groups will experience a fear of deportation. So this examines the daily added stressors on undocumented immigrants and their families. It leads to constant stress, and these families often living in fear of daily events such as contact with law enforcement, asking for resources, or something as simple as opening your door. So that is why we thought it was important to define these terms before we get started.
So, as previously stated by Mariana, the law has been changing now that President Biden took office. But going back to former President Donald Trump, during his administration, there was a zero tolerance policy where parents were forcibly separated from their children. These parents would await their hearings for legal proceedings, and they were sent to federal jails while their children were sent to detention centers. And during this time, the hearings would take up to years and or even like the shorter ones would take months, but they didn't know how long it would take. And during this time, parents didn't know where their children were placed. The families were not notified of their family members' children's, and most times they would say that the children were just misplaced or missing. So it's kind of absurd to hear that ICE or Homeland Security just misplaced a kid. So the United States legal system during that presidential campaign or during the presidential time of President Trump was more harsh towards undocumented families, but that has not changed by a law during the presidential time of President Biden. And let alone in 2020, 177,391 individuals were forcibly detained by ICE. And during this time, police would just knock at the door and arrest family members, not ignoring the fact that children were able to see this, therefore causing more fear of deportation not only on the children but also on family members, because most of these families would be scared to go out, whether that was just simply to go grocery shopping or to the doctors. They were denied just giving out their information because they thought that ICE would come and take their family away.
When these minors are separated from their parents, they are placed into detention centers. In 1980 and 1990, there was a Florida settlement that occurred. This is when lawsuits were filed against the government for the mistreatment of minors. From this settlement, there were guidelines that were settled for what care these minors should be receiving. These guidelines stated that these children cannot be held longer than 20 days. During their time there, the minors should be provided with access to food, water, medical assistance, and proper hygiene. This also included toilets and sinks and adequate temperatures. They also needed to have adequate supervision, and they must be separated from any unrelated adults, and they should be allowed contact with the members who were arrested with them. Unfortunately, this isn't what is happening in these detention centers. They're placed in spaces that are so small. These spaces are set to hold 125 individuals, yet sometimes they hold 900. They are so small that they don't have proper bedding to sleep in, and sometimes they just sleep in the concrete floor. They don't have opportunities for baths, and the temperatures are very, very cold. They also experience poor hygiene. There's babies that are being fed from unwashed bottles, and there's not enough diapers to be changing them. The children have no opportunity for a bath, and sometimes they remain in the same clothing that they arrived in, and this clothing can be covered in bodily fluids such as urine, and for those mothers, breast milk. There's also inadequate food. These children are fed on tray portions, and they all get the same amount regardless of their age. They're exposed to light 24 hours a day, and there's no proper care for infants. These infants are being given to other 7 and 9-year-olds who do not know how to properly take care of them. They also lack adequate mental health and medical care, and there's been a lot of deaths due to these reasonings. Based on what we have seen, we hypothesize 4 different hypotheses. We hypothesize that immigrant children are more likely to experience additional ACEs due to the experiences they're living in. We experience that from birth to 5 years old, due to separation from their parents, these children's attachments will result in insecure ones that will lead to future negative mental health outcomes. For 6-year-olds to puberty, through observational learning, immigrant children exposed to parental fears of deportation are more likely to experience higher stress and anxiety levels regardless of their legal status. And for puberty to 18 years old, we hypothesize that individuals that are constantly facing microaggressions, along with the worry of being separated from their parents, won't be able to complete their identity.
And in order to know how these immigration policies and separation from families are affecting children, we will go ahead and talk about the psychosocial effects on immigrant children. And in order to do that, we have to highlight what ACEs are. So ACEs are defined as potential traumatic events which occur before the age of 18. And it has been found in the literature that children of color are found to experience ACEs at a higher rate than white non-Latinx children. And however, most of the data that has been collected on ACEs lacks the inclusion of immigrant children. And that's why we believe that these children that are not included in the data will be more vulnerable to experiencing ACEs and having a more traumatic response to what they experience on a daily life when they fear not only the deportation of their parents, but also to them of the deportation of themselves.
To begin with, we will begin with the age group of birth to 5 years old. This stage will cover the attachment period. And to begin with, I will explain 3 different psychological theories that tie into this. First, beginning with John Bowlby, who was the first to develop the idea of attachment. Attachment is the infant's ability to seek proximity to their caregiver. Bowlby believed that attachment was needed for survival and that failure to develop an attachment could lead to psychological disorders. He defined the failure to develop an attachment as maternal deprivation. And in a study conducted by him, he observed how infants responded when they were separated from their mothers. Through this study, he found that infants responded in three stages. The first stage was the protest stage. In this stage, children cling to their parents and they scream and protest angrily when they are being separated. In the second stage, it is a stage of despair. Here, they are being they seem to calm down a little and the crying reduce, but they are very withdrawn and refuse care from anyone else. In the last stage, it is a detachment stage, and that is when these children have been separated from their parents for so long and they seem to be normal, but they show rejection towards their parents once they're reunited. The next psychologist is Mary Ainsworth, who worked along Bowlby and developed this strange situation study where she observed how infants responded with their mothers when they were left around with a stranger. In this study, she established three types of attachment. The first one is the secure, and these are the children who know that they can explore and rely on their parents to be there. Insecure avoidant is when children who are independent emotionally and physically from their parent, and insecure ambivalent refers to children who are both dependent and clingy from their parent. They may seem to need them and then refuse their attention when it is given to them. She determined that the best type of attachment is the secure attachment, and that has the healthiest future outcomes. Insecure attachments can lead to failure to develop healthy relationships and healthy ways to explore the world, which in turn can lead to negative health outcomes. Lastly, Harry Harlow demonstrated the importance of human contact through his monkey love experiment. In this experiment, he tested to see whether monkeys preferred to be with the wired mother or a clothed mother who didn't have food. His study showed that monkeys preferred the clothed mother, suggesting that infants have an innate need to touch and cling onto something for emotional support. These theories tie into immigration because unfortunately these children are not receiving any warmth and comfort in these facilities as they have established a no-touch rule in order to protect the teens in these facilities. But this no-touch rule is affecting the younger children who need this touch. Bowlby and Ainsworth established the importance of working models in relationship to attachment. Ainsworth believed that insecure avoidant infants view themselves as unworthy and unacceptable, and that insecure ambivalent have negative self-image and exaggerate their emotional responses as a way to gain attention. When separated from their caregivers, as these children are in the facilities, this leads to a disruption in their attachment style, resulting in insecure attachments, which can lead to psychological disorders that will affect them in the future. The outcome of broken attachments from these separations can also result in infants treating their caregivers as strangers when reunited if they have interpreted themselves as abandoned. They may develop a sense that they have done something wrong to be left alone, and this ideal can lead to feelings of shame and guilt that can lead to complex emotions that shape their relationship interactions in the future.
For this stage, we'll be looking at 6 years old through puberty. So Albert Bandura's social learning theory states that children learn through social behaviors through the process of observational learning. Bandura's Boba the doll experiment examined observed aggression and whether or not a child is likely to mimic that behavior. They found that children who observed the aggressive model were far more likely to show aggressive behaviors than children who observed the non aggressive model or were in the control group. This can also be applicable stage. We'll be looking at 6 years old through puberty. So Albert Bandura's social learning theory states that children learn through social behaviors through the process of observational learning. Bandura's Boba the doll experiment examined observed aggression and whether or not a child is likely to mimic that behavior. They found that children who observed the aggressive model were far more likely to show aggressive behaviors than children who observed the non aggressive model or were in the control group. This can also be applicable for observed stress. During this time of undocumented families, the parents or caregivers are likely to experience high levels of stress due to fears of deportation. During this age range, kids are able to listen to family members' worries or what they see or hear on TV or even at school. They're likely to experience feelings of uncertainty, fear, and increased vigilance. Reports from parents and providers of child behaviors and actions suggest that children as young as 3 are deeply aware of the Trump administration's anti immigration sentiment that we saw during their time in the office. And the possibility of losing a parent was very great at the time. Children may not be able to fully understand immigration policy or enforcement at this age, which may lead to them fearing the worst. Children also may be unintentionally learning from their parents to be fearful in society. Like mentioned previously, contact with police can become a very stressful event. And then prolonged exposure to stress may lead to toxic stress. So, toxic stress is described as prolonged activation of the stress response with a failure of the body to recover fully. Lack of support, reassurance, or emotional attachments may heighten the effects of toxic stress. Children who experience this early in life are more likely to develop long term adverse health effects, such as maladaptive coping skills, poor stress management, unhealthy lifestyles, mental illness, and physical disease. Moving on to Erik Erikson's stages of early psychosocial development, they are described as development as a series of 8 stages, each with a unique crises for psychosocial development. If these stages are not resolved, that aspect of development may be stunted and may limit their ability to resolve future crises. So for this specific one, we'll be looking at industry versus inferiority stage. So Erickson puts that at about 5 to 13. At this stage, kids are gaining independence at their age. They are increasing their social interactions through schools or other events. Um, and through social interaction, encouragement, and positive reinforcement, children have the ability to gain self-esteem and confidence. However, if the environment and or those around them do not encourage it, or if they are restricted, for example, if they are held in a detention center, a child may be likely to doubt their own abilities later on in life. As previously stated, there was a no touch rule in place at these facilities. They were not able to experience any sort of comfort. And more importantly, they were separated from their families. They were too busy trying to survive and to cope with traumatic events without ever having the opportunity to learn how to cope. So, relating this back to Erickson's stages of development, immigrant children are likely to experience feelings of inferiority, doubting their own abilities as they age, and they may lack encouragement to succeed later on in life. And lastly, for this age range, I wanted to touch bases on ACEs. So, as we described, some of the most prevalent ACEs experienced in the US include economic hardship, family separation, or divorce, with about 1/4 of children experiencing at least one of these two events. Immigrant children face further challenges in their lives due to either their or their parents' legal status, and consequently have a higher chance of experiencing hardship with adverse long term effects. Both the prevalence and risk increased for smoking, severe obesity, physical inactivity, depressed mood, and suicide attempts as the number of childhood exposures increased. This puts not only immigrant children's psychosocial development at a disadvantage, but also their physical health in peril.
And for this next age group, we will be focusing on puberty, which is 12 years, about 12 years to 18 years old. The reason why we're limiting it to 18 years old is because an individual is considered an adult once he or she turns 18 years old. And in order to look at how this age group is affected, I will go ahead and talk about Erik Erikson's fifth stage of psychosocial development, where Erik Erikson talks about identity formation versus role confusion. And so during this stage of psychosocial development, it is crucial for individuals who are transitioning from childhood to adulthood to experience the world outside of them, to explore schools that they want to attend for college, for example, to get engaged with their community, to explore things that they like to do as far as it goes with jobs or just a hobby. But when it comes to undocumented immigrants, these children are often they often feel like they're neglected by society because not being documented places so many barriers on their end where they can't explore the world freely as other individuals. They're not able to apply for jobs that they want to explore in order to find out if that's what they like. They're not able to apply for a specific college that they want to go to because they fear that they will not have enough scholarships to pay off for their education as they do not receive federal aid. Um, and so most of the time, these children just don't find a way to socially develop if they don't have the support from community members. And that's where Lev Vygotsky comes in, which talks about the social cultural theory, where he explains that the environment in which children grow up will influence how they think and what they think about. And so, therefore, if these children that are undocumented have a supportive social system around them, letting them know that they are supported and that they also are able to enjoy their life and explore just like anyone else without fear of deportation or being separated from from their parents, these children will be able to achieve the fifth stage of psychosocial development, where they will be able to form an identity and just know who they are as a person without fear of expressing who they are. But if these children don't have the support system around them, they will feel like they're neglected from everything. They will oftentimes go to substance abuse in order to cope with the fact that they are not able to experience the world around them just like their counterparts. So now going on, we will go ahead and talk about the discussions and then the outcomes as well. So, as far as it goes with adverse childhood experiences, immigrant children are more likely to experience additional ACEs due to the family separation and fear of deportation, regardless of their legal status, because either they are undocumented or their parents are undocumented. So, they either experience the fear of deportation themselves or they fear for their parents being deported. And this can lead to multiple adverse psychosocial and physical health effects, such as higher risk of smoking, obesity, depression, and suicide. Because, as I previously stated, when these individuals are constantly worrying about getting a family member deported or getting deported themselves, they are prolonged to more stress, which will later on cause them to use substances to cope with the fact that they're under stress all the time.
For birth to 5 years old, as mentioned previously, they are missing this whole attachment with their parents. They're missing that touch. So these children are missing that critical period of attachment, and this period is from birth to 5 years old. This is therefore leading to insecure attachments. And these insecure attachments can lead to higher risk of psychological disorders that will follow them through for the rest of their years.
For 6 years old through puberty, so about 12, through social learning, immigrant children exposed to parental fears of deportation are more likely to experience high stress levels. And then constant exposure may lead to toxic stress, which can heighten the risk of mental illness, physical illness, and maladaptive coping skills.
And then for puberty to 18 years old, identity confusion is more likely to result when individuals live in communities that have a negative perception of specific immigrant groups. Therefore, toxic stress during adolescence can lead to substance abuse as a coping mechanism, and individuals won't be able to fully form identity of themselves. And when we oftentimes see that these adolescents are placed in detention centers, they are oftentimes going through their crucial identity formation period when they're being detained far away from their parents. So this raises significant questions whether it's just right for these detention centers to be even happening, whether that is for babies or for young adults, because each stage is pretty crucial because they have several stages that they have to get through in order to form an identity for themselves.
And lastly, we want to touch base on a couple recommendations for policies, as well as future research. Yeah. So based on the psychosocial theories we discussed, we believe that family reunification should be a top priority. For future studies, we suggest long-term qualitative studies on children who were separated from their families, so that we can continue to examine their psychosocial development as they grow up. We also think it would be interesting for future research to examine levels of resiliency among immigrant children, and children held in detention centers as they age. Additionally, past studies have shown low levels of mental health resource use among immigrant communities. So we would be interested to see if this changes, especially with an immigrant population that has gone through such extreme traumatic events. And for policy recommendations, like I mentioned, family reunification is a top priority. And while we have seen more of an emphasis coming from the Biden administration, not all of the families have been found, not all of the parents have been found. There are parents that are living in the US that are continuing to look for their kids that are held in these detention centers, as well as kids being held and their parent was deported back to their home countries and they have not been able to be located. So we believe that family reunification should be a top priority. And even though the zero tolerance policy was reversed, and even though the Biden administration has replaced the Trump administration, we still see youth being held in detention centers that are no longer called detention centers. However, they are still functioning under the same system. And it's important to note that the size and the threat that ICE holds were built by administrations on both sides. Even though the Trump administration had taken it to an extreme level by targeting migrants in schools, places of worship, hospitals, and workplaces. Additionally, women were forced to have hysterectomies, among numerous other human rights violations. So while we hope for more humanity from the Biden administration, we are likely to still see undocumented communities continue to live in fear in the US. That is why we are also recommending legal protection for immigrant children and their parents. Lastly, the institution that enforces these divisive policies have been built on harsh, militarized, racist, and discriminatory approaches at their core. So we believe that the eventual abolition of ICE is crucial to end these human rights violations against communities that are trying to seek a better life. Many argue that these policies and institutions are fighting for the safety of US citizens and are supposed to be a deterrent for people wanting to come over. But as we've seen, this will not stop people from wanting a better life for themselves and for their families. This will not stop people from searching for safety, and this will not stop people from doing what they feel they need to do to survive. Thank you for your time.